So today's class is excretory system, wherein we will read about the kidney, bladder, ureter, and urethra. So the first class is regarding the kidney and excretory system. Excretory system is a system which is eliminating excess of water, minerals, and toxins from the body through the kidney, ureter, urethra, and urine. రావట్లేదా నర్సింగ్ అంటే వేరే ఉండొచ్చు
Excretory system है
Good. So the excretory system consisting of the kidney, ureter, bladder, and urethra, and the function of which is elimination of the water, excess of water in the body, and also some minerals and toxins that are not needed by the body. So the system consisting of those organs which secrete urine and eliminate it from the body. So this excretory system consisting of those organs which secrete urine and eliminate it from the body. These organs include, so what are those organs? There are two kidneys, one on either side, and two ureters coming from each kidney, then urinary bladder being joined by these ureters, and urethra and urinary bladder opening into the urethra. The function of the excretory system is to eliminate nitrogenous waste products of protein metabolism, urea, and maintain electrolyte and water balance of the body by eliminating excess of minerals present in the blood like sodium, potassium, and chlorides along with water as media for their expulsion. So what is the function of kidney? Kidney is eliminating the nitrogenous waste products which are produced during the metabolism of the protein. So these nitrogen waste products are urea, uric acid. Then it also maintains the electrolyte and water balance. That means the kidney is maintaining the levels of the electrolytes that are present in the blood at a particular level, and if they are in excess they will eliminate more fastly, and they are less they will stop elimination, such that this level of the minerals in the blood is maintained. Then as well water also, water actually we are taking much amount of water, so this water has to be expelled to make sure that the body should maintain only the needed amount of the water in the body. So now the kidney's function is, one is elimination of urea, uric acid which are byproducts of the protein metabolism, other is elimination of salts which are absorbed in excess into the body, and also water which is present in excess in the body. So this function is called homeostasis, that is maintaining a status quo. So this homeostasis means the blood levels of the water, the minerals all are maintained at a constant place. Now it maintains the pH of the body. So this also maintains the pH of the pH is the concentration of hydrogen ions in the body. pH is concentration of hydrogen ions in the body. Now kidney. Kidney are a pair of excretory organs situated retroperitoneally in the posterior abdominal wall in a gutter on either side of the vertebral column at the level of the T12 to T3. Okay, so kidneys are a pair of excretory organs which are having the function of excretion. Then where they are retroperitoneal, that means behind the peritoneum. Where they are situated exactly? In the gutter on either side of the vertebral column at the level of T12 to L3. So vertebral column, the body of the vertebral column is projecting forwards from the back. So on either side of this projected body, we are having some gutter-like structure. Into this gutter, these kidneys are present, where at the level of T11, T12, L1, L2, L3. So at the level of these four vertebrae, three lumbar vertebrae and last thoracic vertebrae, we are having kidneys in the gutter present on either side of the vertebral column. This gutter is formed because of the curvature, posterior curvature of the ribs as well as the elevation of this the body of the vertebra. Now, comparatively, the right kidney is at a lower level than left one. Right kidney is at a lower level because the liver is occupying most of the, so it is maybe pushing the right kidney to a lower level. So on the left side, there is nothing such that to push this left kidney. So left kidney is at a bit higher level. Then the left kidney is longer and narrower in comparison to the right kidney. So left kidney is longer and narrower in compared to the right kidney, which is broader and shorter. Now, measurements. Length is about 11 centimeters, breadth is 6 centimeters, thickness is 3 centimeters. So each kidney measures length 7 centimeters, 11 centimeters, breadth 6 centimeters, thickness 3 centimeters. And weight is about 150 to 170 grams in males and about 20 grams less in female. So the weight is about 150 to 170 grams in male and 130 to 150 grams in female. Now here we are showing the kidney in situ, that is in its position. So there is the vertebral column. Of course, it is also having other structures like aorta, the connective tissue, and inferior cava on it, and of course, it is elevated. On either side, the gutter-like structure, we are having the right kidney and left kidney. Left kidney is at a higher level compared to the right kidney. I told you because of the liver pushing down the right kidney. Then left kidney is longer, whereas right kidney is a bit broader comparatively. Then we are having location. The kidneys occupy the epigastrium, the right and left hypochondrium, right and left lumbar regions, and umbilical region. So, kidneys are occupying epigastrium, then right and left hypochondrium, right and left lumbar region, and the umbilical region. So, kidneys occupy the epigastrium, hypochondrium, lumbar, and umbilical regions. Vertically, they extend from the upper border of the 12th thoracic vertebra to the center of the body of the third lumbar vertebra. So, T12 to L3, it is the upper part of the 12th thoracic vertebra to the middle of the third lumbar vertebra. The right kidney is slightly lower than the left, and the left kidney is a little nearer to the midline than the right kidney. So, right kidney is at lower level, and the left kidney is nearer to the midline comparatively. Then coverings of the kidney from within outwards, that means the fibrous capsule, the first mentioned, is very near to the kidney. Fibrous capsule, it covers the entire organ. It can be easily stripped off in healthy individuals. It is found by the condensation of fibrous stroma of the kidney. So it is almost formed from a part of the kidney, that is the condensation of the fibrous stroma of the kidney. Fibrous capsule, which is very closely adherent to the kidney, but it can be easily stripped in healthy kidney, whereas in case of kidneys which have undergone infection, there is a chance of adhesions forming and it cannot be stripped so easily. Then perinephric fat. So after fibrous capsule, we are having an amount of fat that is surrounding the kidney. So we call it as perinephric fat. So the kidney, fibrous capsule, then perinephric fat, then renal fascia. It is thin along the anterior surface and thick along the posterior surface of the kidney. Above it encloses suprarenal gland and is continuous with the fascia of the diaphragm, hence the kidneys move with respiration. So what is happening? This renal fascia is covering the kidneys outside the perinephric fat. Then it is enclosing the suprarenal glands also. Then it is becoming a single layer and is attached to the under surface of the diaphragm. So what is happening when the diaphragm moves in respiration up and down? The kidney also moves with respiration. So that movement of the kidney along with respiration is because of the renal fascia that is covering the kidneys and getting attached to the under surface of the diaphragm. This you have to remember. See, here we are showing a section, a transverse section of the lumbar region wherein we are seeing the lumbar vertebrae. Then we are seeing the renal fascia. The outermost one is the renal fascia. This one here, it is the renal fascia. Then inside the renal fascia we are having the perinephric fat. Then inside we are having the capsule, fibrous layer, and then kidney. So kidney, fibrous layer, perinephric fat, and renal fascia. This renal fascia is attached to the undersurface of the diaphragm. So along with this renal fascia, the kidney also moves up and down along with the respiration. So in the respiration, diaphragm moves. As the diaphragm moves, the renal fascia pulls the kidney up and down along with the diaphragm. Now there is a pararenal pad of fat which is supporting the kidney in this area. So perirenal fat, pararenal fat. Pararenal fat by the side of the kidney, whereas perirenal fat is around the kidney. Then we are having a renal fascia outside the perirenal fat and a capsule inside this perirenal fat. Capsule is the first covering that is covering the kidney, and it is developed from the fibrous tissue of the kidney itself. Pararenal pad of fat is the layer of fat that is abundant on the posterior surface of the kidney. External features. Each kidney is having two poles, a upper pole, a lower pole. Two surfaces, anterior surface, posterior surface. Two borders, medial border, lateral border. So, I am talking about the right kidney. So, each kidney is having a upper pole, a lower pole, anterior surface, posterior surface, medial border, lateral border. The upper pole is broad and in close contact with the corresponding suprarenal gland. So the upper pole is in contact with the suprarenal gland. The lateral border is convex, whereas the medial border is convex above and below and concave in the middle. This concavity in the middle is because of the hilum of the kidney, where from the structures enter and leave the kidney. So the structures that are entering the kidney are the renal arteries, whereas that are leaving the kidney are ureter and renal veins. So they are arranged in an order from anterior to posterior. The anterior most is the renal vein, then renal artery, and finally renal pelvis. Renal pelvis can be easily differentiated from other structures by its bent downwards. So renal pelvis is not straight, it is a bent structure. Whereas the renal vein is thinner and having a larger lumen. Whereas renal artery will be thicker and having, of course, lumen is less when compared to the renal vein. So we are having renal vein, renal artery, and renal pelvis, which is having a bend downwards. Now, what are the structures that are in relation to the kidneys? Anterior surface or posterior surface. Now, first we will read about the structures related to the anterior surface of right and left kidney, because there are different structures. So, for the right kidney, the right suprarenal gland, also for left kidney also left suprarenal gland. So on the anterior surface we are having right suprarenal gland on right kidney, left suprarenal gland on left kidney, and second part of the duodenum on the right kidney, whereas spleen and stomach on the left kidney. Spleen, stomach and pancreas on the left kidney, and liver is there in the anterior relation of the right kidney, and right flexure of colon, jejunum, whereas left flexure of colon and jejunum are common. So here the difference is only the second part of the duodenum on the right kidney, whereas spleen, stomach and pancreas on the left kidney. Then of course duodenal flexure, I mean the left colonic flexure, that is splenic flexure on left side, whereas hepatic flexure on the right side. Then of course jejunum is common. So right suprarenal gland, left suprarenal glands are common. Second part of duodenum and liver on the right side, whereas on the left side stomach, spleen and pancreas. So instead of liver there is stomach, spleen and pancreas. Instead of duodenum there is stomach. Now the right flexure of colon on right side, left flexure of colon on left side, jejunum on both sides. So that is the structures that are related to the anterior surface of the kidney on the right side and left side. Then on the posterior surface we are having diaphragm common on both sides, 12th rib 12th rib is in the posterior surface of the right kidney, whereas in the posterior surface of the left kidney we are having 11th and 12th rib, because we told you the left kidney is at a higher level compared to the right kidney. So here we are having the 11th and 12th rib as posterior relation of the left kidney. Then psoas major, same both sides. Quadratus lumborum, same both sides. Transverse abdominis. So these three muscles, psoas major, quadratus lumborum, transverse abdominis, are both related to the, related to the kidneys on both sides. These three muscles, what are these things? Psoas major, quadratus lumborum, and transverse abdominal. These muscles are related on the posterior aspect of both right and left kidneys. Then subcostal vessels are not same. Iliogastric and ilioinguinal, iliohypogastric and ilioinguinal. So these are all common. Only the difference is 12th rib, 11th rib is in relation to the left kidney, whereas in relation to the right kidney, only 12th rib. In relation to left kidney, 11th and 12th rib, both ribs, two ribs are in relation to the posterior surface of the left kidney. The other things, psoas major, quadratus lumborum, the transverse abdominis muscle, then subcostal vessels and nerves, iliohypogastric vessels and nerves are same on both sides. That's the right side, right structures, left side, left structures. So here we are showing the areas of the kidneys that are related anteriorly to the various structures. So here they first we say the right kidney, suprarenal gland. Then we are seeing the liver. Then we are seeing the duodenum. Then colic area, jejunum. On the right side. Whereas coming on to the left side, suprarenal is common, whereas gastric area and splenic area are there instead of hepatic area. Then pancreas is also there, and here duodenum is absent, whereas colic and jejunal areas are there. So that's how we are having anterior relations of the kidney. Whereas posterior relations on the posterior, see we are seeing from posterior side, so we are seeing the left side and left only, right side and right only. So in the left side we are seeing the 11th and 12th ribs in relation to the posterior surface of the kidney. The other things, the area of the quadratus lumborum, then the transverse, what is this muscle? Transversus abdominis. So area of the transverse abdominis, area of the lumbar sacrum and psoas are same on both sides. Only thing is there is 11th rib and 12th rib on left side, whereas only 12th rib on left side. As we are seeing from posterior aspect, we are seeing left and left side only, right and right side only. Now the macro structure of the kidney. In a naked eye examination of the coronal section of the kidney, that means when you cut the kidney into anterior and posterior halves, that is coronal section of the kidney, we are seeing an outer reddish brown cortex, an inner pale medulla consisting of renal pyramids, and in between the pyramids we are having the renal columns. So here, a diagrammatic structure I will show you first. This part is the cortex and this part is the medulla consisting of the pyramids. And in between the pyramids we are having renal columns. This part, these are the renal columns which are extension of the cortex. So we are having a cortex, a medulla. In the medulla we are having calyces, and in between the calyces we are having the renal columns. And of course we are having this renal pelvis, then ureter. These are the structures that we are going to see in a sagittal section. No, not sagittal, coronal section. That is dividing it into the anterior posterior halves. Sagittal section means you have to get into right and left parts. Now we are seeing the coronal section. So we are seeing the longitudinal section of the kidney, wherein we are seeing a cortex, a medulla. In the cortex, we are having the substance which is more densely colored, whereas a medulla is paler one, wherein we are seeing the pyramids, and in between the pyramids we are seeing the renal columns. Then we are seeing the minor calyces, then major calyces, and finally renal pelvis and ureter. So microscopic structure in the naked eye examination of the coronal section of the kidney shows outer reddish brown cortex, an inner pale medulla consisting of the renal pyramids, and in between the adjacent pyramids we are having renal columns. So the medulla is consisting of renal pyramids as well as the renal columns. A space renal sinus is there, and then microscopic structure. This part is called renal sinus. Yeah. See, renal sinus, this part. Just near the, what is that? Renal pelvis, we are having renal sinus. Microscopic structure. Each kidney consisting of 1 to 3 millions of uriniferous tubules. This tubule consisting of two parts, secretory and collecting. Secretory part consisting of structural and functional unit of the kidney, the nephron. So we are having 1 to 3 millions of uriniferous tubules. This tubule consisting of two parts, a secretory part and a collecting part. The secretory part consisting of structure and functional unit of kidney. So, secretory part consisting of a nephron, which is a structural and functional unit of kidney. Nephrons, there are about 1 million nephrons in each kidney. Its length varies from 50 to 55 millimeters. Then function. The filtration of metabolic end products. So, the function of nephron is filtration of metabolic end products. Selective reabsorption of useful substances from glomerular filtrate. This is the second function of nephron, which is done in the renal tubule part of nephron. Then secretion of some materials in the into the renal tubules. Again, there is also a function of renal tubules. So, types of nephrons. So, we are having the unit, the filtration unit is a nephron. Nephron is about 50 to 55 millimeters in length, and its function is filtration of metabolic products, first thing. Then, selective reabsorption of useful substances from the glomerular filtrate. Then, secretion of some materials into the renal tubule. So these are the three are the functions of this nephron. Then there are two types of nephrons, which are cortical nephrons, which mainly reabsorb sodium, and juxtamedullary nephrons, mainly for reabsorption of water. So cortical nephrons for reabsorption of the sodium and water, whereas juxtamedullary nephrons for reabsorption of water only. So now we are describing the nephron. A nephron presents the following parts. Bowman's capsule. So, it is a bilaminar structure covering the tuft of capillaries called glomerulus. So, the nephron is made up of a tuft of capillaries called glomerulus. That is covered by a Bowman's capsule, which is a bilaminar structure. Then it is having two layers. One is inner layer, that you can say visceral layer, and the other is outer layer called parietal. The glomeruli are derived from the terminal branches of afferent renal arteries. The filtration of blood occurs at this site. Filtrate is collected in Bowman's space. So what is happening? Here this is the afferent arteriole, which is giving rise to large number of arterioles, a tuft of capillaries, large number of capillaries. So here a tuft of capillaries are there, which are again joining back into a afferent arteriole. So here you should observe that the afferent arteriole is wider than the efferent arteriole. So what is happening? When the blood is going from the afferent arteriole through the capillaries into efferent arteriole, there is a rise in hydrostatic pressure of the blood. So because of the rise in pressure, the fluid part with some minerals is pushed out of these capillaries into the, see, out of these capillaries, the blood and the liquid part of the blood and some minerals are pushed out, and that is collected in the Bowman space. This is because of the pressure gradient. The pressure will be less in the afferent arteriole, which is having a broader, lumen, whereas it will be more in afferent arteriole because it is having a narrower lumen. Then, what are the structures intervening between the blood and the glomerular capillaries and the Bowman capsular space? So here, the blood in the glomerular capillaries, as it wants to go into the Bowman space, what are the structures that are separating it? So the first and foremost thing is the endothelium of the capillaries, flattened penetrated endothelium of the capillaries. Then this endothelium is supported by the basement membrane. So basement membrane of the capillary endothelium. So flattened fenestrated endothelial cells of the capillaries is the first line of cells that is objecting the filtration of the blood into the Bowman's capsule. Then, so we are having the fenestrated flattened endothelium of the capillaries. Then basement membrane of the this fenestrated endothelium is supported on a basement membrane. So that is also separating the blood in the capillaries from the Bowman's capsule. Then the foot plates of the podocyte cells of the Bowman's capsule. So Bowman's capsule is having a visceral and peritoneal, I told you. So the visceral layer is surrounding the capillaries, which is having the foot plates of podocytes. These are also, forming a barrier in transfer of blood from the lumen of the capillaries into the Bowman space. So I told you this filtration is because of the difference in the size of the lumen of the afferent and efferent arteriole. The afferent arteriole is having a larger volume, larger size of the lumen, whereas the efferent arteriole is having smaller size of the lumen. So there is a pressure gradient because of which filtration is occurring, and the blood present in the glomeruli is filtered into the Bowman space as preliminary part of the form of the urine. Now, renal tubule consisting of the proximal convoluted tubule and loop of Henle. So, renal tubule is the next part of the nephron. Apart from the Bowman's capsule, Bowman space, we are having renal tubules, which are the continuation of the Bowman space. So, proximal convoluted tubule is the continuation of the Bowman space. So, as the renal capsule or nephron is ending in the proximal convoluted tubule, which is continuation of the Bowman space. Columnar cells with microvilli on the luminal surface line the proximal convoluted tubule. So this proximal convoluted tubule is lined by the columnar cells with microvilli on their luminal surface. Till now, this microvilli is not found in any part of this urinary system, whereas from now onwards, there are this columnar epithelium with microvilli. Microvilli is for absorption only, as we see in the small intestine. The surface of the villi are covered by microvilli, making a striated border. So these microvilli are very numerous in number, and they are not able to be distinguished as separate entity, and so they are called a striated border there. Here, this microvilli will be able to reabsorb the already filtered solution that is present in the Bowman's capsule. Each tubule is about 60 micrometers in length. So each tubule is about 60 micrometers in length, and this tubule is having the columnar cells, endothelium of the columnar cells, which are having microvilli. Now, loop of Henle. The proximal convoluted tubule continues as loop of Henle, which has a descending limb, a loop, and ascending limb. It is lined by the flattened cells. The distal convoluted tubule is the loop of Henle continues as distal convoluted tubule, which later joins the collecting tubule. The distal convoluted tubule is lined with cuboidal or low columnar epithelium, and it will not accept it is this distal convoluted tubule is not having microvilli. That means it is not reabsorbing water. The distal tubule is about 30 to 40 microns in diameter, and collecting tubules. From this distal tubules, collecting tubules start, and these collecting tubules collect urine that is formed in the nephrons. How is this urine formed? First, the blood is filtered into the Bowman space. Then, from this filtrate, again the needed substances and water is reabsorbed in the distal convoluted in the proximal convoluted tubule, in the loop of Henle, and a part of distal convoluted tubule. From them, what is remaining will become urine, and it will be thrown into the collecting tubules. And these collecting tubules unite to form duct of Bellini, which open into minor calyces. Then the filtrate collected in the Bellini's part to the minor calyx. So the filtrate collected in the duct of Bellini passes to the minor calyx. The minor calyces unite to form a major calyx, 2 or 3 in number, which open into the renal pelvis. The urine collected in the renal pelvis passes through the ureter to be collected in the urinary bladder. So then, what is the calculation? The 1700 liters of blood circulates in the blood. So the amount of blood that is circulated in the blood in 24 hours is 1700 liters. Then out of which 170 liters of filtrate is collected in 24 hours. In 24 hours, it will collect filtrate of about 170 liters into the Bowman space collecting ducts and other things. Then 1.5 liters of urine is excreted in 24 hours. So the amount of urine that is excreted in 24 hours is only 1.5 liters. So here we are showing this part is the nephron, having a thick afferent arteriole and thin afferent arteriole. Because of the pressure gradient between the thick afferent arteriole and thin afferent arteriole, there is an extraction into the Bowman space. That is, the fluid from the capillaries is extracted into the Bowman space. Then from the Bowman space, it is going into the proximal convoluted tubule, then the loop of Henle, and the distal convoluted tubule. So in this proximal convoluted tubule, what is happening is sodium, chloride, water, and glucose are being reabsorbed, amino acids, proteins, acetic acid, and bicarbonate. These are the substances that are being reabsorbed in the what is this one? This is the proximal convoluted tubule. Then proximal convoluted tubule is going to end in the the loop of Henle, the descending loop of Henle, the loop of Henle, and then ascending loop of Henle. Then ascending loop of Henle, once it reaches the retromorphic area, you will be seeing that the ascending loop of Henle will be going into the collecting ducts. These collecting ducts will unite to form duct of Bellini, and which will be opening into the minor calyces and then into major calyces, renal pelvis, and ureter. Now, artery supply. The renal artery arises from the abdominal aorta. The right renal artery is longer than the left renal artery, and each renal artery usually divides into 5 segments, forming the segmental arteries which enter the hilum. Within the renal cyrus, each segmental artery branches into several lobar arterioles and then which lie in the renal columns between the medullary pyramids. So in the medulla, we know that there are pyramidal structures, and then in between the pyramidal structures there are renal columns. These columns are having these arterial branches. Then they further divide into arcuate and interlobular arteries. Then afferent arterioles from these interlobular arteries form glomerulus. Tough capillary plexus in the Bowman's capsule. So they are formula. From the other end of the glomerulus, efferent arteriole leave the Bowman's capsule. Because of the high pressure in the glomerulus created due to the smaller diameter of the efferent arteriole, the filtrate is forced out of the blood into the Bowman's space. So this filtration of urine is occurring in the Bowman's capsule because of the gradient of the pressure. That is, more pressure in the afferent arteriole, less pressure in afferent arteriole and more pressure in efferent arteriole. The kidney generates about 1 liter of this filtrate every 8 minutes, of which 1% ends up in urine and the rest is being reabsorbed by the uriniferous tubules. That is the tubule, the proximal convoluted tubule, the loop of Henle and distal connective tubule, and that will be returned to the blood. Now, the efferent arterioles arising from the glomerulus form 2 types of capillaries. The vasa recta. These capillaries loops extend into the medulla, running alongside a loop of Henle. Then these vasa recta are part of kidney's urine concentrating mechanism. The vasa recta finally joins the interlobular vein. Then the peritubular capillary plexus. They are low pressure porous capillaries that readily absorb solutes and water from the tubules. These peritubular plexus join in retrolobular vein. The vasa recta capillaries loops extend into the medulla and running alongside of the loop of Henle. The vasa recta are part of kidney's urine concentrating mechanism. The vasa recta finally join the interlobular vein. Peritubular capillary plexus, they are low pressure porous capillaries that readily absorb solutes and water from the tubules. These peritubular plexus join the interlobular vein. Venous drainage. Intralobular veins join to form the arcuate veins, which further form interlobular and finally renal veins. Each renal vein drains into the inferior vena cava. Juxtaglomerular apparatus. Groups of cells which involve in increasing the glomerular filtration rate and thereby bringing back the normal volume of blood of the body. The cells are macula densa. These are specialized cells lining the distal convoluted tubule where it is in contact with the afferent arteriole. Then the cells of Polkicin and Lasix cells, these are otherwise called. These are clusters of cells between the vascular pole of the nephron and distal convoluted tubule. Then juxtaglomerular cells, these are the cells in the tunica media of the afferent arteriole and situated very close to the macula densa. So macula densa, cells of Pulsky, then juxtaglomerular cells are these structures which are maintaining the flow of the blood into the kidney. Now functions. When the afferent arteriole pressure tends to fall, the macula densa releases renin. The renin-angiotensin mechanism results in secretion of angiotensin II, which directly acts on the smooth muscles of the arterioles, producing the vasoconstriction. Therefore, the blood pressure is raised. It also acts on the zona glomerulosa of the suprarenal cortex, and stimulate the secretion of aldosterone, which increases the blood volume by retaining sodium and water. Applied anatomy. The renal fascia and fat around the kidneys fold them in normal position. A loss of this fat with a rapid weight loss can drop the kidney to a lower level. Due to this dropping, there is a kinking of ureter can occur and blood vessels can also get a kink. So this will damage the kidneys. That means the blood supply or venous drainage is compromised. As well, the kinking of the ureter will obstruct the outflow of the urine. So thereby there is a damage occurring in the kidney. In surgical exposure of the kidney, when sometimes 12th rib is resected for easier delivery of the kidney, the danger of opening into the pleural cavity should be borne in mind. So when you are exposing the kidney from the posterior aspect, if you resect the 12th rib, it is easy to reach the kidney. Whereas sometimes the 12th rib is very short that it cannot be palpated. So by missing the 12th rib, you are resecting the 11th rib. That means there is attachment of the pleura to a part of the left rib, which can be told during this resection of the 11th rib. So you should be careful to, resect only 12th rib only. Then the lower part of pleura lies in front of the 12th rib and behind the diaphragm. When the 12th rib is absent or is too short to be felt, the 12th rib may be mistaken, 11th rib may be mistaken for the 12th, and the chance of opening pleural cavity are generally great. So here, the lower border of pleura lies in front of the 12th rib and behind the diaphragm. When the 12th rib is absent or is too short to be felt, the 11th rib may be mistaken for the 12th rib, and the chances of opening the pleural cavity by the side of the 11th rib is possible, is greatly increased. So, lithotripsy has replaced the conventional method to some degree. The angle between the lower part of the 12th rib and the outer part of the erector spinae is known as renal angle. It overlies the lower part of the kidney. Tenderness in the kidney is elicited by applying pressure over this angle. So, renal angle, if you are asked, it is present between the lower part of the 12th rib and the outer part of the erector spinae muscle. So, like this. And it overlies the lower part of the kidney. So this, the renal angle present between the lower part of the 12th rib and the outer part of the erector spinae is having the lower part of the kidney inside it. Tenderness in the kidney is elicited by applying pressure over this angle with the thumb. So if you press with a thumb in the renal angle, there is a chance that you may elicit tenderness if at all present in the kidney. Now, blood from the ruptured kidney are passed in the perinephric abscess. First distends the renal fascia, then forces its way within the renal fascia downwards into the pelvis. It cannot pass to the opposite side because the renal fascia, septum is there, fascial septum is there, which is attached to the midline. Kidney is palpated bimanually with one hand placed in front and the other hand behind the flanks. So, when enlarged lower pole of the kidney becomes palpable on deep inspiration. The floating kidney can move up and down within the renal fascia but not from the side to side. So, the kidney can move up and down along with the respiration, that is along with the diaphragm, along with the renal fascia, but it can't move from side to side. The common disease of the kidney are nephritis, pyelonephritis, tuberculosis of kidney, renal stones and tumors. So these are certain diseases that can affect the kidney. So what are these things? The nephritis, pyelonephritis, tuberculosis of the kidney, renal stones and tumors. And then how these diseases are getting manifested. The common manifestation of kidney disease is renal edema and hypertension. The raised blood urea indicates suppressed kidney function and renal failure. So kidney transplantation can be done in selected cases. So the common manifestations of the kidney disease or disease of the kidney is renal edema, hypertension, then raised blood urea, which indicates the suppressed kidney function, and renal failure. The kidney transplantation can be done in selected cases. The three main waste products excreted in the urine, the urea, uric acid, and creatine. So that ends our kidney. So kidney with a stenosis of renal artery can produce a systemic hypertension. Kidney's function can be estimated by calculating the blood levels of the urea, uric acid and creatine, or urine levels of urea, uric acid and creatine. Then in the common manifestations of kidney, we say it is the renal edema and hypertension. Hypertension is the cause of result of the disease of the kidney, as well as edema of depending parts can also result from the failure of the kidney. Then the common diseases are nephritis, pyelonephritis, tuberculosis of kidney, renal stenosis, and tumor. Renal stenosis means the renal artery is stenosed, thereby leading to the hypertension in the body. Then we are having renal angle between the lower part of the 12th rib and outer part of the erector spinae. It overlies the kidney, and tenderness in this area can be elicited in the diseases of the kidney. Okay, that finishes our kidney and excretory system. Mainly, you should be knowing that the function of nephron, the functional and structural unit of the kidney is nephron. The function of nephron is filtration, then reabsorption, then secretion of some material into the thing. The filtration is occurring in the nephron from the afferent arterioles. The filtrate is going into the Bowman space. From there, it is going to the proximal convoluted tubule, then the loop of Henle and distal convoluted tubule. So, in this proximal convoluted tubule, there is reabsorption of water, bicarbonate, then sodium, glucose, and certain other things which are needed by the body, and it will continue into the descending loop of Henle, the loop of Henle, the ascending loop of Henle. As it reaches the distal convoluted tubule, the process of formation of urine is almost complete, and from there it is collected into collecting ducts, which are forming a duct of Bellini, and then entering the minor calyces. From there entering the major calyces, then renal pelvis, and then going into the ureter of that kidney, and ureter will be going to the bladder. So that is the excretory system. Thank you.